ব্রিটেনের অন্যতম ক্যান্সার বিশেষজ্ঞ এবং সার্জন ডক্টর শাফি আহমেদ। ডক্টর শাফি আহমেদ বিশ্বব্যাপী জনপ্রিয় একজন সার্জন। ডক্টর শাফি আহমেদ গুগল প্লাস মাধ্যমে চিকিৎসাবিদ্যাকে সহজলভ্য এবং আধুনিকভাবে সকলের দুর্গরায় পৌঁছে দেওয়া একমাত্র ব্যক্তি। ব্রিটেনে করোনা ভাইরাস নিয়ে যেমন আতঙ্ক আছে, তেমনি অনেক কিছু জানারও আছে। এইসব বিষয় নিয়েই আমরা 52 বাংলায় ডক্টর শাফি আহমেদের সাথে কথা বলেছি। কেমন আছেন?
Hello. So the coronavirus is a really worrying problem for the UK, and what we're seeing is an increase in the amount of people being affected and suffering and having complications because of this virus infection. The hospitals are trying their best. They're working really hard with all the healthcare workers, trying to help people with the infection and trying to treat them as effectively as possible. So at the moment the NHS is on red alert, making sure that we look after the community as best that we can.
ব্রিটেনের সরকারের উচ্চ পর্যায়ের বিশেষজ্ঞ টিমের সাথে কাজ করা বিশ্বখ্যাত বাংলাদেশি বংশোদ্ভূত সার্জন ডক্টর শাফি আহমেদ মনে করেন, আতঙ্কিত না হয়ে এই মুহূর্তে করোনা ভাইরাস প্রতিরোধে সরকার ঘোষিত সকল বিধিনিষেধ সচেতনভাবে মেনে চলা খুব জরুরি।
So one of the key problems with coronavirus, that it affects elderly people. We say above the age of 60. So this is a huge concern. We have to be very careful about spreading infection to the elderly population because they will have a worse outcome and maybe have death. This is quite a problem at the moment in the UK. So it's important for them to be supported, number one. It's also important for them to be isolated as best they possibly can, avoid the contact that we described earlier around social isolation and social distancing. And so we have to be very careful. Also, people that have coexisting problems like chronic diseases like heart disease, like diabetes for example, or they're on drugs that are causing what's called immunosuppression, and those people are also at risk and they take time away from other people and to be sure they're in isolation. So the other thing we say to people is they're high risk is that you should be isolating for maybe up to 3 months in the situation. So these are the kind of parameters and the actions the government is asking us to do.
কমিউনিটিতে সেলফ আইসোলেশন নিয়ে তথ্য বিভ্রান্তি রয়েছে বলে অনেকে মনে করছেন। এ বিষয়ে 52 বাংলার প্রশ্নের জবাবে এনএইচএস নির্দেশিত সেলফ আইসোলেশনের প্রতি বিশেষ গুরুত্বের কথা উল্লেখ করেছেন ডক্টর শাফি।
If you happen to be getting an infection, by that we mean having symptoms, and the symptoms they describe is a dry cough that's persistent and also a fever of more than 37.8 degrees, 100 degrees Fahrenheit. If you have one of those, you are potentially infected with coronavirus. Now, we have to remain calm. Most people won't have major complications. Most people recover fairly quickly after 2 or 3 days. So if you have those symptoms, the idea is you have to self-isolate for 7 days if you're on your own. If you're part of a family and you're infected, the whole family has to go to self-isolation for 14 days. And that's quite clear from the government. So we'll say that again. If you're infected or you have symptoms, you take 7 days in self-isolation. If any member of your family has an infection, you take 14 days together in self-isolation. So the idea of self-isolation is to diminish, reduce the contact with other people as far as possible. That means you take precautions. You don't go unnecessarily outside. You don't go to restaurants and cafes and outside for shopping if you possibly can avoid it. You try to avoid all contact as far as possible. That is what self-isolation means. There's something called social distancing, which means you take precautions being away from people. So there's no hand touching, for example, no handshakes, not being in a gathering of people like in a mosque. You should avoid going to the mosque immediately for any kind of gathering of prayer, for example. So taking every precaution to avoid the contact. But simple things that we can do are quite straightforward, and that's washing your hands. Washing your hands for 20 seconds as regularly as possible will avoid the transmission of the infection to other people. Also, if you're going to sneeze or cough, you do it into a tissue and you throw it away, or you do it into your elbow, for example. You avoid handshaking, you avoid any closeness, and that's the kind of thing we expect from people, just to be clear, just so that it avoids the transmission of infection.
করোনা ভাইরাস থেকে বাঁচতে আবেগ নয়, দরকার বিশেষজ্ঞদের নির্দেশনা মেনে চলা। করোনা ভাইরাস প্রতিরোধে দলবদ্ধভাবে সামাজিক ও ধর্মীয় অনুষ্ঠান বাদ দেওয়ার বিকল্প নেই বলেও মনে করছেন পৃথিবীর 150টিরও অধিক দেশে স্বাস্থ্যসেবায় কাজ করা এই বিশেষজ্ঞ।
We should try to avoid having gatherings for prayer, for congregation. We're now closing mosques. We're telling people to avoid gathering in Jummah in terms of prayer. We should not do this. This is dangerous. It will affect people around you and transmit infection, making many more people worse. We should also avoid having parties, avoiding weddings, any gathering of any description, birthday parties, going to a restaurant. All of those things need to be minimized as far as possible. And I would say we should stop that. We need to really adhere to really stringent and strong social distancing. It's the only way this infection will be controlled, and it will mean that less people ultimately would die of the problem. And that's all of our responsibility.
প্রবীণ ও স্পেশাল কেয়ার নিডেডদের সেবা প্রসঙ্গে সরকারের উচ্চ পর্যায়ে বিশেষজ্ঞ হিসেবে কাজ করা চিকিৎসক শফি আহমদ বলেছেন, আতঙ্কিত না হয়ে মানসিকভাবে উজ্জীবিত রাখতে প্রতিটি পরিবারের গুরুত্বপূর্ণ ভূমিকা রাখা উচিত।
My message to the elderly people who must be really concerned and worried and anxious with all the news around coronavirus and the effects of the infection is to remain calm and also to ensure they take precautions to avoid infection. And that means being careful with contact, washing your hands regularly when you're walking through the door, after you've left the building, when you're washing yourself, constantly washing your hands for 20 seconds at a time. Also, to avoid human contact, try to avoid shaking hands, and also avoid people that might have infection, for example, other symptoms. I think it's about being sensible. The actual rate of complications is actually quite low, but higher in elderly people. Hence, we have to make sure that we look after you properly. Get support from your family. If you feel that you haven't got the right food, for example, or right support, ask for help. We're all here to help you. All your community will support you as best they possibly can, and also take precautions to avoid infecting you as well, to ensure that we look after you the best we possibly can.
স্কুল বন্ধের সরকার ঘোষিত নির্দেশনা বিষয়ে তিনি বলেছেন, শিক্ষার্থীদের মানসিক মনোবল শক্ত রেখে ঘরে বসে লেখাপড়ায় মনোনিবেশ করা উচিত।
So if you're a student at the moment about to study for GCSEs or A-levels, you must be really upset, disappointed and concerned about the future. The truth is we're not quite sure what's going to happen at the moment. What we know is we're taking precautions to save lives today and to make sure that you're safe in your environment. We don't put you in any risk only because we need to avoid any potential escalation of infections. Don't worry, the government, the education services will have a plan of action, and they'll, over the next few weeks, they'll tell you the plan about how they approach the exams, whether you pass or fail, how you're going to do the exams, whether you have to resit them or whatever. But what they're going to do is ensure they have a comprehensive plan in place that's safe, effective, and it will be reassuring for you to know that. So my thoughts are, remain calm, try not to stress yourself too much, because these are unprecedented times in the history of man. So we just need to make precaution and ensure we do the best for you. One of the most important things to state is that it's about our community. We have to support one another through this. It's not easy. This is about sharing knowledge, sharing experiences, also making sure we avoid contact where possible. Also supporting the elderly, our children, explaining to them what's happening, remaining calm all the time, watching the news, watching the information, and making sure we adhere to best advice. That's all that we can do. But it's up to all of us, every person in London, in the UK, to make that problem much better. And inshallah, at some point, we'll get over this, we can move on, the world will come back to normal, and in time, we can resume our normal lives. For the time being, we just have to be very, very careful about this infection.
লন্ডন থেকে প্রচারিত কোটি প্রবাসীর কণ্ঠস্বর 52 বাংলা। 52 রক্তস্নাত প্রতিশ্রুতি আমাদের স্পন্দন, মহান মুক্তিযুদ্ধ আমাদের চেতনার উৎস। 52 বাংলা টিভি, বাংলা সংযোগ দেশে দেশে। কানেক্টিং বাংলা গ্লোবালি।